I'm delighted to introduce colleagues throughout Wales to a new phase of the Safe Care Partnership, which brings together partners and key stakeholders to achieve national quality and safety priorities across NHS Wales.
The Safe Care Partnership was first launched in March 2022, and its initial phase culminated with the Safe Care Collaborative, which ended last summer. Building on the comprehensive learning, insights and successes from the first phase, the NHS Wales Executive has been co-designing a new Safe Care Partnership with colleagues across NHS Wales, public contributors representing service users and the wider population and other key stakeholders.
This new Safe Care Partnership will be an important approach for achieving national quality and safety priorities that have been identified together by health boards and trusts, the NHS Wales Executives and Welsh Government. The priority areas initially in focus are deconditioning and acute deterioration, alongside a duty of quality leaders work stream that will focus on establishing quality management systems across NHS Wales.
There is a lot to achieve in these areas. However, work is already progressing with an exciting new framework and methodology that has been published to support the adoption of quality management systems in healthcare. More than 30 projects from across NHS Wales have been accepted into a learning collaborative within the Partnership's deconditioning workstream, which will build upon work of the 6 Goals national programme. Following implementation of early warning scores across all age ranges, which is being supported by the new Acute Physical Deterioration Implementation Network, the Acute Deterioration Workstream will support the service to improve escalation systems and establish call for concern services throughout Wales.
As quality and safety priorities emerge over time, this new Safe Care Partnership will be dynamic to them, continually evolving to address them as part of ensuring a safe NHS Wales for both service users and staff. As an example of this, planning is currently underway to introduce a further workstream to the Safe Care Partnership later in 2025, focusing on preventing healthcare-acquired infections in our hospitals.
There is no doubt that challenges persist for us throughout NHS Wales. However, the new phase of the Safe Care Partnership offers a real opportunity and a key mechanism for us to achieve meaningful change for the benefit of both staff and the people of Wales. Teams throughout the NHS Wales Executive will provide multifaceted support for members of the Safe Care Partnership, which will include coaching and advice, access to varied resources and a new Leading for Quality and Safety Improvement programme that will empower leaders with knowledge, skills and strategies to foster and sustain a culture of service safety and continuous improvement.
We have so much talent in NHS Wales, and the new phase of the Safe Care Partnership is a critical opportunity for us to come together and focus our collective efforts into achieving sustainable change that will put quality at the centre of healthcare. Thank you for your dedication to this work. I am looking forward to seeing the excellent progress that I know we can make in the months ahead.